Good palliative care, I think, is really looking at what we can do to really support the whole individual. It moves away from a common way of thinking about care, which is a medical way of thinking about care. Not that good palliative care doesn't include that, but good palliative care really looks at managing the physical symptoms, the emotional symptoms, the stress that might come from having a disease. Probably what makes it palliative is just an understanding that it's probably somebody who may have a life-limiting illness. Good palliative care is extraordinarily important for dementia patients, and I think it really just aligns with the way that I'm beginning, and I hope others in the field are really beginning to look at what we can do to really meet the needs of somebody impacted by dementia. One of the important messages that I think is coming out in my country, and I think probably in others as well, is this idea that even though a person has a diagnosis of dementia, maybe due to Alzheimer's disease or something else, that first and foremost, they are still a person. And they still have the same needs, physical needs, basic needs, and emotional needs. And that those needs don't diminish just because somebody has dementia. So, however, a diagnosis of Alzheimer's disease or a related dementia does mean that this person, may likely die of causes due to their illness. But at the same time, if we really apply palliative care model, and I would really propose, and one of the things that I hope to take back with me from this conference, I would really propose that a palliative care model should really be implemented at the time of diagnosis. Because then it really coincides with what I think of is basic good care for somebody living with dementia. It would take a look, it would look, number one, at just making sure that, yes, their physical needs are being taken care of, but I think even more important with somebody living with dementia is that there's also an understanding that their spiritual needs still need to be met, that their emotional needs still need to be met. And maybe what's really important, and I think sometimes forgotten in dementia, is that people with dementia can still make decisions really well into their disease. They might not be able to remember, something that somebody told them a while ago, or they might not remember to take a medication. They might need some assistance or cueing with that. But people with dementia maintain the ability to share their perspective, their opinions, their ideas. They're innately curious and creative, which means that if we think about the whole idea of being a participant in your own care and in your own well-being, people with dementia really have the capacity to do that well into their disease. I think one of the things that often occurs when somebody receives a diagnosis of dementia is there's this assumption that with that label, this individual can no longer do certain things, certainly not make decisions on their behalf. So I think the whole palliative care model hopefully takes this message and really underscores that the person is still there, see the real me, and I really can continue to make decisions, and I still have the same needs that anybody without this diagnosis would have.